accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this annual meeting of the Franklin Township Board of Health was made by the posting on the bulletin board in the municipal building, posted on the Township's website, and electronically transmitted to the officially designated newspapers, indicating that this annual meeting would take place in Council Chambers Municipal Building at 6 p.m. on Tuesday, June 13, 2023.
We'd all stand for the Pledge of Allegiance. To the flag. Madam Clerk, please call the roll.
Deputy Mayor Barrison?
Here.
Councilwoman Francois? Mayor Kramer?
Here.
Councilman Olijaka?
Here.
Councilmember Potosnik?
Here.
Councilwoman Pruitt?
Here.
Councilwoman Udine?
Here.
Councilman Vasanella?
Here.
Councilman Wright?
I present the Board of Health with the June 28, 2022 minutes, the Board of Health for approval. Do I have a motion to accept?
Motion.
Second.
Moved and seconded. Any discussion? Corrections? Madam Clerk?
Deputy Mayor Barrison?
Yes.
Mayor Kramer?
Yes.
Councilman Olijaka?
Yes.
Councilmember Potosnik?
Yes.
Councilwoman Pruitt?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
So for those people watching, Council wears two hats, and one of our hats is that we are the Board of Health, not the Department of Health, not the Advisory Board of Health, but we are the Board of Health. And we are required to have a meeting a year, and we're having the meeting tonight. And the next item on the agenda is the Advisory Board of Health report. We have someone from the Advisory Board of Health to give the report. You have to, I'm sorry, you have to come up. Otherwise, you won't get recorded for posterity. The manager and Mike Turner honorer, Bob Bornlacher.
Hello. My name is Jim Karwoski. I'm the chair of the Advisory Board of Health. I don't have a specific report other than to say that we invite you to come and join us, and the public to come and join us more often than they have up to now. We meet the first Wednesday of every month at 7:30 p.m., somewhere in this general vicinity. That, I have nothing more.
Thank you, Jim. Next item is Somerset County Department of Health 2023 annual report.
Good evening, everyone. I'm Mike McCarty. I'm the Deputy Director for the Somerset County Department of Health. I believe I've met some of you, a couple of you probably virtually. I have Himanshi Patel with me. She is the epidemiologist for the Somerset County Department of Health. And I have Patty Elliott with me. She's the Consumer Health Program Coordinator. She probably doesn't need any introduction with you guys, though.
We know her well.
Yep. So
You sound like the governor now. She needs no introduction.
Right.
As like flashback to conferences every day.
So I've already hit some technical difficulties because this computer apparently doesn't have PowerPoint on it, so bear with me with these slides that we're doing through email. If you guys have any questions on any of the slides, please feel free to jump in and stop me. If I can't answer, perhaps one of Himanshi or Patty can, and if not, we'll get you an answer. So this is a general overview. I hope this isn't too basic for anyone, but basically what this is what the services that the Somerset County Health Department provides for you guys. This is all in line with Title 8, Chapter 52, which is Public Health Practice Standards. So really it's consumer health. That's your recreational bathing inspections. That's your retail food inspections, your public health nuisance complaints, things of that nature. We're fortunate enough to have 4 full-time health education staff on in our department. That's unusual for most of the health departments that I've seen, but given that we have a pretty big program area, it's really a nice plus to have. One of those health educators works for the Chronic Disease and Cancer Prevention program. We at Somerset have a joint coalition with Morris County. Basically what that is we provide programming, screening, health education for all things cancer and chronic disease. Environmental compliance, that is our County Environmental Health Act section. Essentially what that is those are our DEP representatives. There you go. Thought I was talking too loud or something. There we go. It looks even better. So, yep. So basically that is our New Jersey Department of Environmental Protection arm. We have 4 full-time inspectors and an administrative staff in that section. We're looking to add a health educator in that section too. Basically, that's your air, noise, water, that sort of, that sort of enforcement that happens on that end. We have our epidemiology, nursing, and disease prevention program. We do have 4 full-time nurses on staff. We do have Hamachi, our epidemiologist, on staff, handling communicable disease cases, tracking, follow-up, all that good stuff. We have an emergency preparedness coordinator in our department. That section's obviously been very busy over the last couple of years. And then we have our childhood-led prevention program. Really, there should be a last one here. It should be administrative functions. That's been increasingly important given that the amount of grant funding that we've received over the last 2 years has been pretty significant. So there's administration should be in here as well. But yeah, I think that's basically a general overview of what we do, so we can move to the next. This is just our this is our team here. This is basically the structure from top to bottom. This is actually pretty much full staff for us. We're missing a couple people right now, but in the 9 or 10 years or so that I've been here, this is about as full staff as we've had. This is actually, it's really encouraging given that during COVID, we probably turned over about 50% of our staff over the last 3 years. So to get back to a full complement of staff has been really helpful, and we've been able to get back to routine business, so to speak. So we can go to the next one. This is Franklin specific, right, Patty? Yes. Okay, so these are Franklin specific numbers. This is Patty's section. So this is, again, your retail foods, your pools, your septic systems, your, housing and all that good stuff. So for 2022, they did 451 in retail food inspections, 79 re-inspections, 204 temporary retail food inspections, 6 mobile foods, 971 multiple dwelling inspections, and then we also did some septics, child daycares, recreational bathing, and new wells as well. So those are pretty substantial numbers, but like I said, luckily we've been able to keep and retain the staff that we've had, so we were able to get that done. This is more along the same lines with consumer health. So we received 26 complaints and did 43 investigations for retail foods, 72 garbage complaints received, and 223 investigations. So you'll see the number is a little bit higher because each investigation might constitute another follow-up at the property or at the business. 14 complaints about vermin insects, 30 investigations, 95 property maintenance complaints with 260 investigations, 44 complaints against housing or multiple dwelling with 140 investigations, and 8 complaints, other complaints received and 10 investigations. This is a general overview, kind of, if the goal, mission statement, if you will, of the health education program. Basically, health education is really intertwined with all the facets of the health department. We use them for really a multitude of different things, and they help us out during grant deliverables and things of that nature. These are the people that are going out doing the events at the ballparks. These are the ones that are coming to our vaccination clinics and passing out information on flyers. And they're like, these are our priority areas: the lead poisoning program, chronic disease. They do work for environmental health. Like I said, we're hoping to get another one there. healthy habits, and emergency preparedness. This is just some examples of some of the stuff that the health education team has put together. We do have a very good team. We've recently been able to promote one of them to the health education program coordinator position, so we're really fortunate to have 4 full-time people there. If you have any questions on any of this stuff, please feel free. If you as a board or as the advisory board wants any specific programming that's kind of within our wheelhouse, please let us know, and we'd be happy to be able to create some content, create some flyers for you guys.
In that regard, I had a question.
Sure.
Do you do any, especially consistently I'm sorry, not online, on premises, in-person training with food handling? I see up there online, and I'm sure that's great, but food handling is such a big issue. I couldn't see how that could be done substantially without in-person ongoing training, especially with the turnover often of workers.
It's a great point. Prior to the pandemic, not to use that as a catch-all excuse for everything, we were doing in-house programming once a month. We were doing training. We've stopped that for the time being, but we do want to resume that, maybe not on a monthly basis, but maybe like on a quarterly basis. To supplement that, like you said, we did procure what's called ServSafe tokens for our food handlers to use. That's beneficial in certain ways because ServSafe is a little bit of a step up from the training that we would provide. We only provide basic food handlers training. You can take the ServSafe. It's a little
But the ServSafe type, that level, you or them or someone can do it in person?
At this time, we're trying to reboot that, to do it kind of like on a quarterly thing, to have it in person and invite all of our 9 municipalities for their food handlers to do that.
I don't know how other towns or other, but
Yeah.
I would personally feel that would be,
No, when we had done that in the
they're
past
asking
for a
for
long
suggestions,
time.
that
Yep.
would be one of the most important things I could think of.
Yeah, absolutely. We have had discussions on trying to reboot that. Monthly didn't always work out because we were getting, maybe 3 or 4
understand.
people. But we do want to try and get that quarterly again and see if there's a place that we can host that. But it's definitely a good point and something I'll bring back. I think we're on to the next one unless anyone had any specific questions on this. So this is our RCDC. This is a little bit what I mentioned before. We hold the grant between Somerset and Morris. This is basically focused solely on cancer and chronic disease prevention and management. We hold workshops, programming. We do a lot of health education events. There's an element of this for patient navigation. If someone calls and says, Somerset County, I don't know how I can get to my appointment or whatever, we can help navigate them through the system. And we do have a cancer thriving and surviving, tongue twister, program that we also do, and we have several staff members that are trained in giving that program. A little bit more on the RCDC. So this is the whole coalition. There's different, counties for whatever reason, usually geographically, but not always necessarily, are more bound together. So these are a little bit of the statistics that we did. 83,000 mailings to patients and community members, a little over 4,800 phone calls to patients about HPV vaccine and scheduling, and we did conduct a social media campaign with, that's a measurement, is 788,000 impressions. Doesn't always mean that we're getting passed through on that, but at least it's a pretty big number, and we do feel that we're reaching a good amount of people. This is, as I had mentioned, this is our DEP section. This is our CHA inspectors. So for the last calendar year in Franklin Township, received did 171 total inspections. 19 of those were solid waste related, 5 were safe drinking water related, 14 were air emissions permits related, 47 complaints, and 86 open public record acts requests. The next slide shows a little bit of the GIS maps that we've been doing and showing you exactly where the complaints might have taken place. Aaron and Lynette were good enough that they could, and maybe Himanshi too, were good enough that they could designate by color which each complaint was on the map, so you can see that, and you can immediately look and say, oh, that's an air complaint, or oh, that's an odor complaint.
Sorry, I have a question about that last chart.
Surely.
I couldn't see it. Go back to the, I believe in you. Thanks. So, oh, you got it back. Oh, because I can't see it too well. It's small. Look, I can't get it right now.
I can't make it bigger.
No, that's fine. So the very top, it's like reddish orange color.
Single-use paper, plastic bans, so now we have to do that enforcement as well when we take those complaints.
Okay, thank you.
So it could have been a supermarket, deli, grocery.
All right, I asked you to do too much things.
Bob, if you want, oh, there you go. I was going to say, I could have just. So this is the section we have epidemiology, nursing, and disease prevention. Basically, the main goal for this is to reduce the spread of communicable diseases in Somerset County, doing that through timely investigations and contact tracing. So this group was obviously very busy over the last couple of years. A couple of the program highlights is we have the communicable disease prevention and control staff that are investigating all the communicable diseases as per New Jersey Department of Health guidance. Our staff does a lot of work with schools, daycares. The nurses will do immunization audits, so they're going to the schools and making sure that all the children that are there have received their, their vaccinations that they're required to have to be in school. We have staff that will review the tuberculosis cases that we get. We contract that through, I believe it's called ID Care. They're out of Robert Wood Johnson, but effectively they're a subcontractor of us. And along the same lines, we have the Zufall Health. So we contract with them for STD testing, HIV testing, child health clinics, well visits, and things of that nature. So I do have some statistics from that they were able to provide for us as well. Yep, next is good. So this was from last year. So this was your total communicable disease confirmed cases from June. So yeah, from June 2022 till now. So obviously a lot of that's just COVID related. The next slide here, this is basically statistics from the Zufall Health Center. Like I said, we contract with them for certain things. And I'll talk a little bit more about our relationship with Zufall in a couple minutes, but effectively they reported that they did 111 well visits and childhood immunizations to uninsured children, 125 adult physical exams and immunizations, 290 adult screenings for chronic illness, 117 STD tests, and 74 HIV testing and counseling. So, and then again, we contract with ID Care for our tuberculosis clinic, which we hold in Robert Wood Johnson Hospital. This was their snapshot for 2022. 15 cases of pulmonary TB, infectious TB was 15, and then there's a couple other little sporadic ones. They treated 4 cases by private physicians in other jurisdictions.
Just a comment on that.
Surely.
You just mentioned Robert Wood Johnson. Most here in this room will associate Robert Wood Johnson with New Brunswick, not Somerset. I think you mean Somerset,
Robert Wood
correct?
Johnson, Somerset, correct. Yep. This is a snapshot of the emergency preparedness section of the department. Basically, they're responsible for putting out the advisories, alerts, updates, recalls. So there's some numbers here on the bottom. 196 messages were disseminated, 88 public health recall messages, 3 public health training announcements, 6 messages about public health updates. Public health advisories did 30 messages, 6 messages for alerts, and 73 other links messages. This is a little bit about basically our emergency, our pandemic response. So in 2022, we had 116 vaccination clinics. We administered 6,167 shots. 276 flu shots were administered. 201 monkeypox vaccinations. We did a school COVID clinic in April 2022. We did a senior center clinics in January, February, April, September, October, and December. And we did a few monkeypox clinics in September and October of 2022. This is our childhood lead poisoning prevention program. Essentially what happens is we are notified of children when they receive a blood lead level of 5 micrograms per deciliter of blood or higher in repeat tests. Basically what will happen then is that triggers our nurse case manager to go out, and then if that does not rectify the issue, then an environmental inspector will have to go out, see if we can determine what the source of the lead is in the dwelling or school, or in certain instances it can be a grandparent's house, a babysitter's house. So we do have a couple inspectors on staff, and we do have a full-time nurse case manager dedicated to that. So this is the raw stats for that program. Last year we had 23 children that met that criteria. Of those 23, we had to conduct 9 inspections, and of those 9, 5 of those required abatement from the property owner or homeowner.
That in Franklin Township or the 9 municipalities?
This is the 9 municipalities. Luckily, Franklin Township has, I don't know if this is just anecdotal or just my, my perception of it, but seemingly the cases have been going down, which is good news, but I don't want to say too much because the state will be following the CDC guidance and lowering the blood lead level from 5 to 3.5 later this year, so we're expecting to see an uptick in that number. And these are just, the next slide is just raw screening totals. This is the information that's reported to us. So for you guys, Franklin Township in 2022 had 730 children meeting the criteria that were screened for lead.
Meeting the criteria to be screened, or that?
Just that usually it's anybody under the age of 2. I do believe that there's going, and any time that
Okay, so not 730 children with lead toxicity?
Oh, no,
Okay.
they were just screened for, yes, having it. There is new legislation that's going to be introduced, I believe it's in the Assembly now, where all children that will be attending public school need to be screened before they enter kindergarten. And that's effectively it for the presentation. I don't know if anybody had any questions for me, myself, or Patty or Himanshi. I did want to touch base a little bit about where we're going. I had mentioned that we just recently had a call with Zufall, seeing how we can kind of bridge gaps between the services that they provide and what we might be able to do for them. This year was the first year in the 9 or so years that I've been here where I've seen a grant that we're able to purchase vaccine under. I'm not sure if that just means that that's going to be for COVID vaccine, or if we can use that for influenza, if we can use that for any other sort of childhood immunization vaccine that we might be able to do. We are not a VFC vaccines for children provider at this time, but hopefully that might change, and that's an avenue that we would be able to partner with Zufall about. we did receive additional grant funding this year, so that'll help us buy new software. That'll help us receive public health accreditation, offset a little bit of staff salary, hopefully help us hire a little bit, and things of that nature. But yeah, other than that, I don't have anything else unless the board had any questions.
The director, is that,
I'm sorry, I did mean to mention that Dr. Terry Clancy is my boss. She unfortunately could not make it. She's out on medical leave. But she is our health officer. She's serving in a dual role. She came from the state. She was with their director of EMS enforcement, I believe. She is the director of Department of Public Health and Safety, and she's also the director of the health department at this time, and she is your health officer.
the acting director or full-time director?
Full-time director. She was appointed by the commissioners at a meeting or late last year, I believe, or early this year.
I had a question, Mayor, but if anyone else does,
Go ahead.
gladly wait. Actually, two quick questions.
Sure.
Can someone from the public log on anywhere, I don't know, here, the county, with some portal, to find out the, say, the update, the status, or a resolution, if it went through the process, of a health complaint that they know is out there, whether they made or, something or an ongoing issue? Can they log on and see any legally public information
At this
concerning
time,
it?
it's a great question and one I'm really excited to answer. At this time, no, you would have to file an OPRA request to receive any of our records information. But thankfully, we're joining the 21st century, and with our new, we just finalized our request for proposal. We do have a software solution in mind that we really liked. We demoed them late last year, but this is how slow some of these processes work with budgeting and purchasing. We do have the vendor in mind. They will create an outwardly facing portal for us. So for exactly like you're saying, so you can check your complaint status, whether or not that's been abated, whether or not inspector's been out to check that, whether, if you want to go out to the restaurant next door and see what their current rating is and see what the report is. All that has been promised to us. That's long overdue. We've been using an in-house solution since I've been here, and it was outdated when I got here. So
Fair enough.
Yep.
I obviously, I wish it was there. I'm glad to hear it's going to be there. And all those other things sound fine too, but my main focus was simply, like a permit
Yes.
or whatever. It was in process. I think most townships are set up, and the county with a lot of other things. So, okay,
Yes.
and just a general idea, like by the end of the year?
So, yeah, the RFP will open at the end of this month in the purchasing division. They'll give, I believe, a period, I think it was 30 days, but it shouldn't take that long. And then they promised us within a week they could implement. I don't know how,
Okay.
I don't know how
So
real that is,
maybe
but yeah,
a
hopefully.
little
by the end
luck
of the year.
later on this year.
Yep.
And a little bit in the same vein, is there a system by which one of your county health inspectors, workers, I don't know, the investigators, whatever, they go out to follow up on complaint or just to check on anything out in the field, because different ones I realize come to Franklin for different reasons. And they see what is obviously a blatant health, under the purview of the health department, violation somewhere. Can they just, boom, tap onto some compute, whatever device, and see if, oh, yeah, okay, whether, unless they're personally familiar with it, but, gee, that should probably be, and, there's an NOV, there's a court date, there's a this, can they do that?
Yes.
With
So
technology
that-
out in the field? And is it regularly done if they see something blatantly a violation, to make sure that it's not something that's fallen under the radar? I realize they can't go around looking for things. I'm not suggesting that, but
Yes, we have that capability. We do have, again, I'm hoping it'll be streamlined, it'll become easier with the new database, but we do have Windows tablets that every inspector is assigned that has access to our in-house health database. So they can go on, they can see when the last inspector was there, they can see what the notice of violation number was, they can see the last time that they touched that property, they can see, any,
Gotcha.
when the summons was issued, things of that nature.
normal protocol is they would check if it was something in the purview of the health department. Thank you very much. Good to hear.
Anyone else? Thank you.
Got it.
We have a motion to open to the public.
So moved.
Second.
Moved and seconded. All in favor of opening to the public, say aye.
Aye.
Opposed, say nay. Motion is carried. We are open to the public on Board of Health or Department of Health matters only.
Sure.
Disease program, is it just cancer?
Name and address?
Oh, Linda Powell, 22 Buffer Drive. Is it just cancer that's looked at the chronic disease program?
No, just. Yep.
Anyone else?
Mayor, seeing no one coming up from the public, I'll motion to close the public portion of the Health Board meeting.
Second.
Second.
Moved and seconded. All in favor to close, say aye.
Aye.
Opposed, say nay. Public session is closed. Is there any other business to be brought up? Hearing none, do we have a motion, what? Do we have a motion to adjourn?
So moved.
Moved and seconded. All in favor of adjourning, say aye.
Aye.
Opposed, say nay. We are adjourned. Be well, Franklin.